Disability Rights Arizona. Disability Rights Arizona presents self-advocacy and effective communication in healthcare settings. What to do on the day of your healthcare appointment if you are denied your requested service or face discrimination. Here are some common ADA violations and problems you may encounter during your healthcare visit, and steps you can take if they occur. Problem: healthcare providers do not know how to use the VRI or remote cart system. The ADA has minimum standards for VRI that require that staff be trained to not delay your healthcare services. The Hearing Loss Association of America, or HLAA, has best practices for using remote cart services. If there are delays with setting up the VRI or cart system, make a note of how long the delay was, who the staff member was, and what steps were taken to get the VRI or cart system working. You may consider recording the delay on your phone. Problem: VRI does not work. The ADA has minimum standards that require high-speed internet so that the video is clear and delay-free. If you experience problems with the VRI, tell the provider and ask them to make a note of it in your record. Some problems can include a blurry video feed or freezing screen. Problem: VRI screen is too small or too far away. VRI screens often come in the form of tablets or laptops. For some individuals with visual impairments, these screens may be too small. If you are unable to see the screen, make sure to let the provider know and document what their response is. Problem: you requested an on-site interpreter and they provide VRI. The ADA requires qualified interpreters, and that term includes on-site and remote interpreting. However, some individuals, because of other disabilities or the nature of the healthcare visit, may have difficulties using VRI. For instance, remote interpreters would not be effective for a person with a significant visual impairment. Also, remote interpreters would not be appropriate when providing demonstrations, such as physical therapy sessions. Problem: you do not understand your interpreter. The ADA requires that your interpreter be effective and use the required and specialized vocabulary. If you are unable to understand your VRI interpreter, ask for a different interpreter. If the problem persists, inform your provider that they may need to switch interpreting agencies. If it is an in-person interpreter and the appointment can be rescheduled, ask to reschedule with a different interpreter. The Arizona Commission for the Deaf and the Hard of Hearing, or ACDHH, may provide a list of available alternative vendors. Problem: the provider asks your family member or companion to interpret for you. Providers cannot require a patient to bring someone to interpret. Having a family member or companion may be acceptable only in two situations. A family member or companion may interpret if there is an imminent threat and no interpreter is available. If there is no imminent threat, the patient can request an adult family member or companion to interpret when appropriate. Most healthcare visits should be facilitated through a qualified interpreter because of the complexity of the information. Problem: you are asked to sign paperwork where you waive your rights for on-site interpreting, agree to pay for the interpreter, or agree to pay for missed appointments. The ADA requires that people receive effective communication without charges or extra burdens. If you can't resolve the matter, you can ask to speak to the staff that is responsible for managing accommodations. Patients with hearing disabilities should not be asked to pay for fees that do not apply to other patients. Additional tips: bring your own notebook in case the healthcare provider writes notes to you. If the healthcare provider uses their own notebook to write notes to you, keep the notes, request a copy, or take a picture of the notes if they keep them. If you do not get effective communication during the visit, ask the healthcare provider to document the problem in your file and request a copy of the note. If you've been denied effective communication, you may want to complete a client intake with Disability Rights Arizona. You can contact us through our website at www.disabilityrightsaz.org or by phone at 800-927-2260. This video was brought to you by Disability Rights Arizona through a grant from the Arizona Commission for the Deaf and the Hard of Hearing. It has been made available for educational purposes and should not be used as a substitute for competent legal advice from a licensed professional attorney in your state.